Morning, everyone. Much like the other presenters, I want to start off by thanking Community Access for putting together this event today, and it's an absolute privilege to be invited to come and speak. So, as Clinton had said, my name is Kelly Clark. I work for the Mental Health Association of New York City, and I am the Program Director for NYC Well. So some of the things that I want to cover off today in the presentation is to give you a bit of context around what NYC Well is, then to have a look at how young people are accessing the service, before having a look at perhaps why young people are accessing this service. So for those of you who are not aware, NYC Well is part of Mayor de Blasio's Thrive NYC initiative, which included 54 different initiatives to address substance use and mental health issues within New York City. I'm aware that there is going to be another presentation on Thrive NYC after this, so I don't want to steal anyone's thunder by talking about that too much. But I will acknowledge that part of NYC Well came about because it was acknowledged that the behavioural health system in New York is very complex and it is very fragmented, and at times it can be really quite difficult to navigate that system. So NYC Well serves as a front door to that system and provides free and confidential services for New Yorkers to be connected with care. It actually builds on and expands upon a previous 24/7 mental health hotline that was available in the city. And it provides services 24 hours a day, 7 days a week, 365 days per year. Unlike a lot of other hotlines, one of the features about NYC Well, which is quite unique, is its ability to offer services and access to people via text, talk and chat. And through this, individuals can connect with either counsellors or peer support specialists. And indeed, peer support specialists were one of the areas where the program expanded from its previous iteration. And I'm quite pleased to say that we continue to see the number of people accessing peer support specialists to talk with people who had their own lived experience of mental health and substance use has been increasing month after month since the program launched in October of last year. When connecting, individuals are able to speak to either a counsellor or a peer support specialist who speaks English, Spanish, Mandarin and Cantonese. Or we can connect with over 200 languages through an interpretation service on site. In addition to this, one of the other areas that NYC Well expanded was around offering warm transfers for individuals who contact us via phone during business hours. So this helps to connect people to those services and to eliminate a potential gap in where individuals can fall between the cracks. We know that there are a lot of reasons why someone may find it difficult to reach out for help. And what we don't want to do is create an extra burden of, after you make that first phone call to NYC Well, you then need to make an additional phone call to the referral source. So we will always offer for individuals contacting us during business hours via phone that we can offer that warm transfer. We will stay on the line with you until you make that connection into that referral source. One of the other areas of expansion was the offering of a follow-up service. So individuals contacting across any mode now will be offered follow-up. This is an opt-in service. And what follow-up will do is approximately 2 days after you make that initial contact, a counsellor will make an outbound phone call or text message to you to check in and see where you're at. Did you make it to that referral source that we gave? Have you been able to contact them? You were perhaps a little bit ambivalent. Where are you sitting with that now? And it is also really important to be able to check in to see whether or not that situation has changed. And indeed, if that situation has changed and has deteriorated further, we're able to provide new referrals that might be more appropriate to what that presentation is. During follow-up, short-term counselling can also occur because we know often that there is a wait list to access services. So whilst you may have made that phone call to be able to get the appointment, that appointment may not be for another 3.5, 4 weeks yet. Or more, yes, I will acknowledge that. So what we can do with follow-up services is continue to touch base with you, check in and see, how are you doing? Is it okay if I continue to contact you next week to see whilst you wait for that appointment, to try and keep that individual's motivation up and that engagement up until they can make that connection to care? NYC Well also serves as the single point of access for mobile crisis team referrals in New York City. So this includes both what we call regular mobile crisis teams and the Children's Rapid Response mobile crisis teams. So a mobile crisis response will be 2 clinicians who will go out to either the home or the school, if it's a child as well, to provide an assessment and some supports if someone's experienced a mental health issue. So often this can include individuals who are unable or unwilling to engage with treatment in a more traditional setting, and it requires an expedited response. It's much quicker than what you might find in other aspects. So typically the type of interventions and the type of calls and contacts that we get fall within 3 large categories. So we may get information and referral contacts. So these are calls where an individual may know what type of service that they're after, but may need more details about what's available in that. They may be inquiring as to what services their insurance will cover as well. We're able to provide that information to them. Some people may need additional time to talk through what their issues are that they're facing, and these are categorised as support calls, where we can do some of that collaborative problem solving, develop some coping strategies with them, engage them in terms of what their support network is and how they can develop that in the community, and then make those referrals off to sources that might be relevant. But we continue to access along the continuum all the way to crisis intervention services. So the benefit in this is that we can really meet people at where they're at. So we can be involved in that prevention and early intervention when people are contacting us, all the way through to crisis if that's where they're at the time that they're reaching out to us for help. And one of the really interesting things since launch, which as I said was in October of last year, has been what the demand for NYC Well has been. So in August, we were already 25% above what the expected rate was going to be, and we continue to see an increase in volume. So on a day-to-day basis now, NYC Well has approximately 800 to 900 inbound contacts, depending on the day, and we're seeing that that continues to increase. So you'll notice that I'm not talking about anything specifically youth-focused so far, and that's because NYC Well is not a youth-specific or a youth-targeted resource. However, what it does is it allows us to compare how youth might be accessing this service compared to people who are of an older age group. And before I get too much into data, this is where I want to do my little data disclaimer. So we are only able to access information that is provided to us. We will endeavour to get someone's age on every contact because obviously it's going to help us and help to guide us in that contact in terms of how to develop a rapport that's appropriate, how to ask age-appropriate questions, and also about referring to resources that might be targeted specifically for young people. However, there will be cases where individuals will not provide us with an age, will misrepresent what their age is, so they may want to represent themselves as being older than what they are, or perhaps it might be a third-party caller where they're unsure of what the individual age is. So with that in mind, I am going to reference some data, but I want people to keep that in the back of their minds, and that I suspect that this leads to an under-reporting about our young people who are accessing the service. So we know that in July of 2017, approximately 800 inbound contacts were related to children, preteens or teens, and that 98% of those were related to the 10 to 19-year-old age group. We typically get contacts regarding young people from 3 main sources, the first being providers. And so this includes a behavioural health provider who may be contacting us about a client or a patient of theirs, as well as school staff who may be contacting about a student. These typically account for about 20% of our contacts in this group. We have third-party contacts from family and friends who account for approximately 25%. but 50% of our contacts are coming from individuals aged between 10 and 19 who are reaching out for concerns that they're experiencing. So this prompts the question about how do young people access NYC Well, and does this differ from the older groups? As I said, we offer services in text, talk and chat. So what you're seeing here is the green bars represent our 10 to 19-year-old age group and the blue represent our 20 plus. So across all age groups, everyone prefers to contact us by phone and to talk. That is the predominantly favoured contact mode. However, our young people are showing a much greater adoption across all three modalities and a greater adoption across chat and text. And this makes sense when we think that this is the generation that grew up with chat and text, that we're building on what is already their learned behaviour and what is often their preferred communication method. It's also interesting that chat and text adds an increased level of accessibility here. And I don't just mean in terms of that you have up to 3 ways in which you can contact us now, but also in terms of that you could chat with someone whilst you're on the bus without anyone else knowing, that you could text someone when you're at a party and you're experiencing symptoms. We've certainly had instances of young people contacting us immediately after incidents of bullying as well. So there is an immediacy that it brings to that as well. And then when we look at why young people are contacting us and how does this differ from older people? So on the left, the column there is the aggregate data. So all ages across all modalities, we see that the top 3 presenting concerns are mood issues, anxiety concerns, and stressful life events. And certainly mood and anxiety would be consistent with the prevalence rates that we see in the community. But the 3 columns to the right of that are this 10 to 19-year-old age group broken down by the modality of contact. So 2 things I find quite striking here. One is that interpersonal concerns feature much more prominently in the young people who are reaching out. And that's consistent with this life stage, and that we're seeing young people who are, the subject of bullying during a time in which they're forming their gender identity and they're engaging in relationships. But we also see suicidal ideation coming up there as the second most prevalent presenting concern for individuals contacting us via chat. So this is interesting because it's led us to theorise that perhaps that this is tapping into that shame and fear that there might be in reaching out and talking about suicidal ideation, and a sense that there is more anonymity in chat, that we do not hear a voice, that there is not a phone number that is established with it, that there is a little bit of extra safety built in reaching out through this anonymous method. So I'm mindful of the time here. I just want to recap. So NYC Well is available 24/7, 365 days a week through 3 different modality contacts. What we're seeing is young people reaching out much more consistently across the 3 of those different methods in which they can contact, with a greater adoption of chat and text. But also that it may be that their presenting concern is what is influencing the way in which they reach out to us. Very happy to take any questions or comments that people may have.
So thank you, Ms. Clark. We do have some time for a few questions.
I haven't been able to finish it. Can I just say it? I'm trying to write it so it's
I have
legible.
one more question.
All right.
Sorry. So what can the city and we as New Yorkers do to make contact with hard-to-reach youth?
Yeah, so one of the things that I know that the city is looking at much more, particularly for this upcoming year, I know that NYC Well launched in October of last year, so we're still within that first year. But But there's going to be much more focus on how we can make advertising more youth-friendly. And there's been a lot of outreach that's been happening around the Thrive initiatives as well as NYC Well that have been taking place in schools and with youth-orientated accesses. But I think one of the things that's coming about in particular around this is that the more accessible we can make services by capitalising on the ways in which people can access those services, not needing to go to a physical location so much, but support not perhaps being limited to an appointment time, but in providing some services that can act as supports to those more traditional services for times of higher need, that we can help young people who are needing support at the moment.
Thank you. Do providers or third parties have to get permission from parents to make contact?
So it depends on what services they're looking to request for an individual. Certainly there are issues around parental consent that are needed for things like children's mobile crisis team referrals or in terms of consent from schools at that stage. But it can also, NYC Well can also be an opportunity for providers to talk about what may be some of the options that they could link in their patient or their family that they're working with in terms of services that could benefit everyone. So we're talking about benefiting parents as well as young people and other caregivers who are involved in that situation.
Thank you. Many hospital-based psychiatrists and mental health professionals in New York have telephones or landlines only. Mm-hmm. When scheduling or confirming appointments, they call and can't text. Mm-hmm. I have a client clients
Okay.
who have told me their care was terminated for non-compliance due to the fact that they couldn't text. How would or could NYC Well assist with that?
So this is definitely something that we see a lot in follow-up contacts that we have. Follow-up counsellors will inquire with an individual in terms of whether or not they may have an upcoming appointment or whether they're engaged in treatment and may have upcoming appointments, and will serve to remind them during those follow-up contacts.
They don't know about them because they don't the kids don't listen to their messages on their phones. They only respond to text. They don't even know. So they're not connecting at all. I've had numerous people that this is a serious problem. It means the hospitals need to get cell phones.
Yeah, I mean,
and text.
Yeah, I mean, there are a variety of different programs that you can use that can enable you to send text messages out to individuals that don't require you to have a cell phone yourself to be able to do this. But I think, if anything, what we're seeing from NYC Well is that this is a really key way to be able to communicate with young people, which meets them on their level and builds on that learned behaviour that they have around their preferred communication methods. Absolutely.
Thank you. You mentioned earlier that NYC Well has both clinicians and peers. Do you have any data about if there's a preferred contact for young adults?
I don't have that data with me. It would be something I would be very interested in looking at as we approach out our first year. As I'd said before, one of the things that we are noticing is a growth within with individuals contacting the peer support services that is consistent and at times is of a bigger proportion than the overall growth that we're seeing. So we're certainly seeing, as more people become aware of peer support specialists and engage with peer support specialists, it becomes a preferred contact method for a lot of people. And we can certainly have peer support specialists and counsellors transfer calls between each other if it's appropriate at the time. So someone may contact to speak to a counsellor, during which stage the counsellor might identify that they would benefit from speaking to a peer support specialist and can raise that on the call and then can actually transfer that person across to a peer support specialist so that they're able to engage in that contact as well.
Thank you, Kelly. Last one.
Okay.
Are there any specific times when contacts or days when contacts seem to cluster?
It's interesting. We get quite a spread. What we do see is that traditionally weekends are quieter times but that in itself has changed over the time that NYC Well has been operating, and we've been seeing an increase in contacts over the weekends. I think what we see is different cohorts reaching out at different times. So obviously we have more providers who reach out during business hours, but then we may hit those people who are contacting us after work or school. So we'll then see pockets of contacts that happen around that 4 to 7 p.m. mark. Then we may see a spike in contacts around 2 a.m., which might be the individuals who are having difficulty sleeping, whose distress or their need at that stage is heightened and they're unable to access what their other existing support networks might be, and so then reach out to NYC Well. So we happen to see different pockets all throughout the 24-hour period across 7 days.
Thank you, and thank you for presenting or joining us today, Ms. Clark.
Thank you very much.